Hi, my name is Cassidy. I'm a nurse practitioner. Today I'm going to be doing an assessment of your chest, lungs, and heart.
Okay.
Before we get started, do you have any questions or concerns at this time?
No.
And I'm going to have you start by verifying your name and date of birth.
Brock Kaiser, 6/24/2000.
Great. So do you have any history of respiratory illnesses, diseases such as COPD, asthma,
No.
are you a smoker?
Mm-mm.
Okay. Any cardiac issues?
No.
Good. So to begin the assessment, I'm going to have you sit straight forward and place your hands out. And I'm going to start by inspecting the lateral and posterior view of the chest. So go ahead, take big deep breaths. Okay, so the chest expansion is symmetrical. I'm going to have you lie flat on your back so I can get a good view of the anterior part of your chest. You can put your hands together and take big deep breaths. Okay, good. So chest expansion is normal and symmetrical, so you can go ahead and sit up. Next, you're going to feel, I'm going to locate some landmarks, so I'm going to feel your trachea. The trachea is symmetrical, it is midline, there's no tracheal deviation, and it easily moves. Then we have the suprasternal notch, and then the angle of Louis. Okay, good. So just by inspecting the chest, I'm looking at the lateral compared to the anterior posterior diameter. So the lateral appears larger than the AP diameter, which is a good finding. There's no barrel chest. And so now, Brock, I'm just going to have you breathe normal. Okay, good. So the respiratory rhythm is normal. There's no signs of accessory muscle use. There's no nasal flaring or pursed lips when breathing, and the respirations were at 16. So now I'm going to have you move to the side, and I'm going to palpate your back. So you're going to feel me. I'm going to feel for any crepitus. Okay, so there's no crepitus. That would feel like a popping, kind of cracking. So now I'm going to palpate the ribs. Let me know if there's any pain or tenderness. So the ribs are symmetrical. So now I'm going to go behind you again and percuss. You're going to feel some tapping on your back. I'm going to go on this side, under this arm. So with percussion, it is renaissance. So now I'm going to feel for excursion. So I'm going to have you take a big deep breath, let the air out and hold. Go ahead and take another big deep breath and hold. So go ahead and breathe like normal. So looking at this measurement, it's about 3 to 4 centimeters, which is a normal measurement. Okay, so now I'm going to check for equal chest expansion. So I'm going to place my hands on your back. I'm going to have you pinch your skin a little bit, take a big deep breath. Okay, good. So there's bilateral symmetrical chest expansions. My hand moved symmetrically. So now I'm going to take my stethoscope and listen. Anytime you feel my stethoscope, go ahead, take big deep breaths. Under this arm. And under here. Good. So the lung sounds are bilateral and clear. There's no adventitious lung sounds such as stridor, wheezes, crackles, rales, rhonchi, or a friction rub. So next, I'm going to check vocal resonance. So I'm going to have you, every time you feel my stethoscope, repeat 99.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
So that was equal and symmetrical. I'm going to check for fremitus, so you're going to feel my ulnar part of my palm on up here, so go ahead and repeat 99.
99, 99, 99, 99, 99,
And
99.
okay. So again, fremitus vibrations are felt symmetrically. So next I'm going to have you sit forward and I'm going to do the same to the front. So again, I'm going to palpate for crepitus. There's no crepitus noted. I'm going to percuss. Okay, and fremitus, go ahead and say 99.
99, 99, 99, 99.
And I'm going to listen again. Deep breaths. Again, lung sounds are some bilateral clear. There's no adventitious lung sounds. Go ahead, say 99.
99, 99, 99, 99, 99, 99.
Okay, good. So moving on with the cardiac part of the assessment, I'm just going to start by looking at the precordium. I'm inspecting for any heaves or lifting of the chest. Okay, so there's no visible or heaves or lifting of the chest. So next I'm going to have you lie flat on your back. And again, I'm going to palpate for any heaves, lifting of the chest, or thrills. So we have the aortic, pulmonic, herbs, tricuspid, and the mitral. So there's no heaves, lifting of the chest, or pulsations, or thrills. So next I'm going to look at the jugular vein. So I'll have you scooch down a little bit so your head's completely flat. I'm going to grab my pen light, looking at the jugular vein. I'm looking for pulsations or heaves. Go ahead and turn your head to the side. Sometimes we could see down here. Okay, there's no pulsations or jugular vein distension. So next I'm going to grab a pillow, place this under your head at a 30-degree angle. And again, I'm going to look at the jugular vein. And look to the side. So again, there's no jugular vein distension noted, and there was no pulsations. So now I'm going to feel the apical impulse. I'm going to place my hand here. Okay, and now I'm going to have you lie on your side, on your left side. And again, I'm going to place my hand. Okay, good. So there's no pulsations or heaves noted. You can go ahead and sit back up. So now I'm going to locate some landmarks. So we have the apex of the heart, which is by the mitral. It's the 5th intercostal space, midclavicular line. We have the sternum, so I'll palpate that. And the sternal border. So we have the right side and the left side. Okay. So now I'm going to grab my stethoscope and listen for any abnormalities. So we have the aortic, pulmonic, herbs, tricuspid, and mitral. And at the mitral, I'm listening for S1 sounds. And going back to the pulmonic to listen to the S2. So now I'm going to use the bell, listen for any murmurs. So the cardiac rhythm is a normal rate. There was no murmurs heard. S1 and S2 were heard. There was no S3 or S4 sounds, and there was no splitting. So now I'm going to feel your carotid pulses. I'll feel one at a time. And now I'm going to listen for any bruit. Go ahead and breathe like normal. Not using the bell, I'm going to have you hold your breath. So there's no bruit noted. So that concludes our assessment today. Do you have any questions or concerns?
No.
Okay, thank you for your time.
Thank you.